Welcome everyone. My name is Eleanor Horton and I will be Chair and Moderator for today's webinar for the Community Care Smart Assistive Technology Collaborative. I'm a Senior Lecturer in Nursing at the University of the Sunshine Coast, but for today's session I'm representing as an expert reference group member on the Smart Assistive Technology Collaborative. Today's session is called Do Change, Do Cardiac Health, a New Generation Ecosystem. This is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. Community Resourcing uses their international expertise and networks to build community capacity through empowerment, knowledge transfer, skills enhancement, research and development projects. Community Resourcing has been funded by the Queensland Government to bring together an online platform for community care service providers who are interested in collaborating on issues and practices related to smart assistive technology. Today's session will be delivered by Sander van Berlo. Sander completed his Bachelors and Masters degree at the Industrial Design faculty at Eindhoven University of Technology. Sander's master's degree project was an e-health ecosystem that combines behavioural measurement with behavioural change methods to support the adaptation of healthy lifestyles for cardiovascular patients, specifically reducing sodium intake. Sander established a design studio called Onmi, which is developing this concept further in a consortium of 11 European and Taiwanese companies. The project is funded by the European Commission and will take 3 years. I welcome Sander to the platform.
Thank you, Eleanor. Thank you for the introduction and for having me here today to do this webinar about Do Change. Today I would like to talk a little bit about the project, which is ongoing. We'll talk about the goals that we have set for the project, the innovation that we're trying to achieve, and the challenges that we're facing. So first I would like to say a little bit about Onmi. Onmi is a young multidisciplinary innovation and design consultancy based in the Netherlands. We design products, systems and services that focus on building and maintaining health and well-being. We have two directions that we focus on, which are design, in which we design and consult on products that integrate into a change ecosystem, and we also do analytics, so data-driven designs using user-centered analytics for behavior change. We aim to design our products in such a way that they integrate seamlessly into someone's life, so that they become unconscious, autonomous and reparative. So, Do Change. We'd like to start by introducing the primary objective. So the primary objective of Do Change is to develop a health ecosystem for integrated disease management of patients with heart disease, cardiovascular disease. The system will give them access to a set of personalized health services in near real-time fashion. This disruptive system will incorporate the behavior change method, Do Something Different, in conjunction with innovative wearable tools that can scan the nature and volume of food and liquid. We will also monitor clinical parameters and try to achieve all this in a domestic situation. So first I would like to say a bit about cardiovascular disease. Cardiovascular disease is a group of medical problems that affect the heart and surrounding blood vessels. This is high blood pressure, coronary heart disease, etc. Within the Do Change project, we are focusing particularly on patients with heart failure and ICD implants. So cardiovascular disease is a very common illness in Europe. It's a very common disease amongst older adults. Within the European Union, it causes 2 million deaths a year, and it's responsible for the largest number of premature deaths. So this is a very relevant problem in our aging population. how does cardiovascular disease affect the patient? So the effects of a cardiac event are not just physical; they're also have a big burden on lifestyle and emotional, and they have a lot of emotional aspects to the illness. So patients don't just have to deal with the physiological changes of their body, but also with positive and negative emotions while learning to understand the heart condition. And they have to change and adapt new behaviors which they might not have had before the cardiac event. So this can be stopping smoking, quitting smoking, losing weight, eating healthily, taking medications, changing activity and exercise. They might have to stop their job, quit their job. And these are very difficult things to adopt at this moment, and everything comes together in one go. So it's important to realize that this situation is very challenging, not just physically, but also on all these other elements. And in Do Change, we try to focus on supporting the behavioral aspect and the emotional aspect, while also, of course, keeping in account the physiological situation. So the general approach that is used for cardiac rehabilitation is to provide support in a way that focuses on providing information and teaching people how to deal with this new situation. It is effective because it causes 50% less chance of new heart problems and 30% less chance of death due to heart disease. Usually these programs focus on teaching about the condition, providing tailored exercise programs, guiding the changing lifestyle, offering guidance in those changes, giving support on the new medication program, and answering questions that might come up in any of these changes. But studies have shown that the adherence to these medical recommendations can be lower than would be expected. This might be due to a lack of knowledge about the process, a lack of knowledge about behavioral alternatives, lack of professional feedback or intervention. And essentially, we think that is because this general approach is focused too much on providing information and not so much on implementing successful behavior change methodologies that would have greater effects. So what we want to do is changing the scope of the care that is provided. So with simple changes in lifestyle, a better understanding of heart failure, and appropriate treatment, many people would live full and active lives. This is a statement from the European Society of Cardiology. So it's time for an alternative approach to see if we can find new methods to really support the people in this situation. Well, one of the technologies that is emerging a lot, of course, is telemedicine, mHealth technology. It's a changing landscape with appearance of unobtrusive digital and wireless technology. We can utilize this technology in the patient's house, in their home, and it enables us to tailor the care to the person and give them access to health services at any time. But having these devices in someone's house also means we have to deal with security and data, and that we have to design them in such a way that they will work in the context that they are initially created for. So when we look at current or available mHealth technology, we see that a lot of it focuses on clinical health measurements that are done in a distance, so not at the hospital, but in the person's house. And these physiological sensors that are initially designed for hospital settings are now taken into a domestic situation, and we kind of expect them to function in the same way, which of course is very challenging because it's a very different environment. People are in a different mindset. There's different interactions with the device, but also with the patient. So it's a family setting, and sometimes there's a lack of technical support. These devices can be very complex and technical. So it's important to have a new look at this and to try a different approach for telemedicine as well. So I also want to mention a recent study that came out about disability adjusted life years, which is the measure of overall disease burden as expressed as the number of years lost due to illness. This study showed that behavioral risk factors make a greater contribution to these number of years lost due to ill health than any other risk factor. And the biggest risks overall are diet and physical activity. That's an absolute number one. Then tobacco consumption and alcohol consumption. So if we focus this system on changing behavior rather than monitoring physiological parameters, we could have a very interesting effect on the patient's well-being.
Another shipping forecast issued by the Met Office at 23:40 on Saturday the 18th. There are warnings of gales in all areas except Trafalgar. The general synopsis at 1800, Iceland 960, drifting slowly east and filling. Low 250 miles northeast of the Faroes 9540 by 1800 Sunday. High Trafalgar 1033, slow moving with little change. The area forecast for the next 24 hours, Viking north and south Utsira 40.
Is it Chinese? Is it...
Northwest 5 or 6, wintry showers, good, occasionally poor. North Utsira, south Utsira, east 40s, variable 4 becoming southeasterly 5 or 6, west 40s, Cromarty, 4th, Tyne.
00 GMT. Cow in sea area Shannon moving slowly eastwards and filling. Sorry, that should be low in sea area Shannon. And now the area reports. Viking, north of Sierra, south of Sierra, rain at times, good. Westerly becoming cyclonic, good. Humber, Thames, Bedford, Leyland, Daff, Dover, Seoul, Hayth, rain at times, good. White, Portland.
This is a man who lives at home. He's by himself, and he has gotten 3 devices to support his everyday activity and to monitor his everyday activity. One of them is an intelligent walking stick or a cane. The other one is an intelligent fork, and the third one is a sleeping monitor. All 3 devices are well intended and provided to him by his family. And in the video, you see that at the beginning, the man is quite willing to follow all the advice that these products provide him. So they beep and they give him a number saying, you haven't done your steps for today yet. Or they beep and they say, this is a healthy meal, you've already had so many calories, and it keeps counting up. So at the beginning, you see that this man is adhering quite well to this program and to these devices. But after a while, he gets frustrated by it because they're not integrated into one system. He's really using 3 different things at the same time. And after a while, you see that he starts using his regular fork next to his intelligent fork. So he's eating an unhealthy meal and eating a healthy meal, well, fake eating a healthy meal. But the video is a very interesting, well, it's a hypothetical video, but it's a very interesting perspective on the challenge that we face with these telemedicine devices and with all these separate solutions. Because this man is obviously frustrated by it, and the devices become unwanted in a sense. So the challenge that we face is making a solution that integrates all of these products together, and that make more sense than what we see in the video, where it really focuses on alarms and providing information and giving numbers rather than giving him feedback that he can act on more successfully and with a better experience. So please visit the website and look at that video. So the fundamental flaw that we see in many of these lifestyle products is that believing that it's enough to raise awareness by telling, informing, or educating people. We know that knowing does not equal doing. So just simply providing someone with the amount of calories that they've had that day, or telling them that 10,000 steps is what they should do and they've only done 5, does not change behavior. There's a disconnection between what we do and what we think and what we know. So the objective for us is to empower citizens to manage their own health and disease. So we're developing this new ICT health ecosystem that combines do something different, a groundbreaking behavior change methodology that focuses on doing, like I mentioned in the previous slide, and not on knowing. We integrate this with self-management devices. So for this system, we are developing new devices. On the right in this slide, you see some simple sketches that visualize two of the three devices that we're working on. So one of them is an intelligent spatula that monitors behavior during cooking routines and is also collects information about the content of food. The second device we're working on is a sleeve-like device that tracks fluid consumption throughout the day. And the third device is a digital scanner that can understand eating behaviors outside the home. So with these three new devices, we are trying to capture someone's nutritional behavior in and outside their house. And we are combining these devices with existing devices such as an ECG device or an activity tracker or a weight scale. So we are combining these devices to create a holistic approach to combine dietary and lifestyle management and to create greater adherence to medical plans. So the objective for us is to integrate these new concepts that we have with existing devices to create a complete image of the lifestyle and the changes that are desired. So our system will involve patient, caregivers, families, and patients' wider social environment. We encourage secondary prevention and address avoidable negative health and well-being outcomes. We're not just sensing, we're not just creating data, we're also creating a full picture of support around the patient. So the patient takes active role in their healthcare and in their process, and they will share the responsibility of the process. Health professionals with this system will be able to provide low threshold and personalized interventions, also from a distance, so the patient does not have to visit the hospital for these. And like I said, we encourage secondary prevention and put the patient at the center. So with these new systems where we create data about health parameters of a person, there's also a challenge with the data security. Of course, all this information goes into the cloud, and the cloud is vulnerable in a sense. So we want to create a system in which the patient is confident and feels in control of the process and of the data. So what we're doing is to create a personal data store. In principle, this means the rights of the data are given to the individual. They get all the data stored in a cloud-based, personal data store, we call it. In the view of the patient relationships, so the relationships between the patient and everyone else who accesses the system, the patient can authorize everyone and distribute rights that give people access to their data. So they give rights and they give obligations concerning the information that flows between the data store and other partners. So this leads to two principles. The patient becomes a genuine stakeholder in their own process, and they become the ethical integration point of their own data. So a challenge with creating a health ecosystem like this is that we want to integrate several e-health technologies with existing systems that are already out there. We can often design technology and apply it to an existing system, but there might be friction. Maybe a medical professional does not understand fully how to operate the system, or maybe it doesn't fit in with the already existing program. So what we're trying to focus on, and it's a big challenge, is to integrate this whole new ecosystem with the existing healthcare that exists in the Netherlands, Spain, and Taiwan, which is where we will do the studies. And integrating these things presents challenges on different levels. Communication between devices is always a challenge. How do we make devices communicate with each other and with the system? How do we engage the user with the system over a longer period of time? So at the beginning, everyone might be interested in this new solution, but we also want them to adhere to this program, say after 3 months, after 6 months, after a year. How do we analyze all the data that we generate from all these different sources? So both behavioral, physiological, symptomatic. How do we analyze this all and create an accurate dynamic profile of the patient, and then also tailor the feedback and the coaching to this dynamic profile? Another issue or challenge really is ensuring data security and the privacy. And like I said, we will tackle this by implementing new data security methods, such as the personal data store, in which we give the control to the user. E-health technology is often not appealing. We get lost in complex interfaces and products. We sometimes see that products are stigmatizing, and otherwise other ones focus too much on illness rather than the active and healthy or enjoyable life besides it. We want to, in Do Change, we want to involve the user in every step of the process. We're following a user-centered design process in which we, like I said before, try to design them in such a way that they will seamlessly integrate into everyday life. So we focus more on providing positive life changes rather than the illness. So the innovative approach in Do Change creates a balance between behavioral, social, and clinical elements in healthcare. We handle privacy and security in an innovative way. We gather information in a new way by integrating new behavioral analysis products into someone's life. We have a new approach, so we do not focus on providing information and teaching people about what is right and what is wrong, but we tell them what to do, and they will understand afterwards why that was so positive. So this is the do something different methodology. And we have these new individual devices, the micro behavior measurements for the cooking in the house, liquid intake in and out of the house, and dining outside of the house. So this project will conclude after 3 years. It has been going for half a year now, and we will do several studies throughout the project. We're doing process mining analysis to learn about the care pathways that currently exist in the hospitals in all 3 countries. We're creating clinical pathways to understand decision moments and contact moments between patients and the healthcare centers. We are soon doing controlled environment studies with the first prototypes that have been created for the new micro-behavioral measurement tools. This will be with non-patients, and this will give us a lot of input into the usability and into the quality of the design, really, in the context that we aim for. The final study of this project will be a proof of concept. It will be a field study with 150 patients, of which 75 will be control group and 75 will receive the intervention. This project will do these tests in Spain, Taiwan, and the Netherlands. So it will be a very interesting cultural study in which the differences between these cultures will also be very relevant to the success of the intervention. And additionally to this, we will also do a similar study with 20 renal patients, because they face similar struggles to the cardiovascular patients. And really, with this Do Change ecosystem, we are now focusing on cardiovascular, but this new behavioral approach to healthcare could be applied to many other chronic illnesses as well. So we'll be exploring those in the future as well. So then I also want to mention a little bit about the Horizon 2020 program, which is funding this Do Change project. Horizon 2020 is a big new EU research and innovation program, nearly 80 billion of funding available until 2020. In addition to this investment into this research investment, they expect that this will also attract private investment. And this program promises breakthroughs, discoveries, and world firsts by taking great ideas from the lab to the market. So it really focuses on research that can be taken to the market rather than well, just scientific outcomes that do not actually change people's lives. So Horizon 2020 is seen as a means to drive economic growth and to create jobs. It has the political backing of Europe's leaders, and with this, they expect that overall 20% of the combined budget will go towards social challenges. And then they also provide lots of support for SMEs, so small to medium enterprises, because great ideas need to be picked up by the users, consumers, and the market before they can transform society. And small medium enterprises like my own benefit greatly from these programs. So by coupling research and innovation, Horizon 2020 is helping to achieve all this innovation with an emphasis on excellence, excellent science, industrial leadership, and tackling societal challenges. So these are the three directions in which all the projects have been categorized. And the goal, the eventual goal, is to ensure that Europe produces world-class science and removes barriers to innovate and makes it easy for the public and private sector to work together. So within this particular Do Change project is a good example, because we are working with the healthcare sector, big research institutions, but also the private sector. And together we aim to deliver this healthcare innovation. Thank you.
Thank you, Sander, for a wonderful talk on the importance of Do Change, and we have very similar issues in Australian society. We have a question online from Susie from Billawheeler. Co-design with consumers and carers in Australia is not a regular feature of projects incorporating smart assistive technology. How do you think, from your experiences in Europe, we can increase clients and carers' involvement in the actual design process?
That's a good question, thank you. I think with user-centered design, there are many interesting methodologies that can be applied to include both, all stakeholders into the development of these systems, and it can happen at several stages. We are now trying to involve both the medical side and patients early on in the process. There's lots of methods out there that, well, we're implementing several of them. I'm actually going to do a webinar after this one in which I will explain a few of them, because it's a bit difficult to mention specific examples. Currently we are doing lots of interviews with both patients and medical professionals, and we're taking all those results into account for the design process. Yeah, and like I said, I'll be explaining one of those examples in the next webinar.
Thank you. Susie, I hope that was answered your question. Have we any other questions online?
Thanks, Eleanor. Just a comment, it's Anne Livingston, a comment I've made online. Thank you very much, Sander and Eleanor, for arranging today's webinar. I guess in Australia we're seeing a lot of projects that are doing something fairly similar to what has been demonstrated today, not obviously with the level of funding that you've been so fortunate to get from Horizon 2020. And we're really keen to stimulate a discussion with policy and funders about the need to invest in innovation and the economic consequences that would have, as well as the social imperatives that we have for that investment to be made. But I guess I'm really keen to see that we continue a dialogue through the Community Care Smart Assistive Technology Collaborative Platform, and would like to see the opportunity to have ongoing dialogue with you about your project and what other projects in Australia might be able to inform yours, or vice versa. Thanks for a great presentation today, Sander.
Thank you.
Thank you, Sandra.